cases now have crossed the 67,000 mark with a total of 67,152 with over 4,200 new cases in the last 24 hours. That makes it the biggest single day spike in cases. But remember, testing has also been ramped up across the country. So, Kirti, what are we to make of these numbers?
Well, Ankita, worrying at this point of time, considering this is India's biggest spike with 4,213 new cases in the last 24 hours. The last biggest spike that we know of was around 3,900 cases in a day. So this is the first time that India has registered over 4,000 cases within a span of 24 hours. Also, the big worry in terms of which are the states that are reporting these high number of cases, because of which India has seen its biggest spike. Maharashtra has seen the largest number of cases with 1,943 cases. So nearly 2,000 cases in Maharashtra within the last 24 hours, followed by Tamil Nadu with 669, then Gujarat with 398 cases and Delhi with 381 cases. So at this point of time, Maharashtra, of course, where many of the central government teams have also been sent in order to assess the damage there, make amends, get an idea of what has been going wrong, that even hospitals have started falling short. So that has been a worry, and clearly cases continue to increase in Maharashtra and even Tamil Nadu, which has moved up in the rankings. Ankita.
All right. Thanks very much indeed for that, Sukirti. Let's move on for the moment to Maharashtra. And as Sukirti already pointed out, Maharashtra cases seeing a spike and some worrying numbers there. Sort of make sense of those numbers for us.
Well, numbers have been steadily rising and over 1,000 new cases being reported at least over the last few days, and that is clearly worrisome for the state government as well. Now, why do these numbers keep rising? Well, the state government attributes it to more testing, but clearly even with more testing, these kind of figures do remain a worry, and the fact is that the curve in Maharashtra, so to speak, hasn't really shown any signs of flattening. Now, the government says that it's already preparing, especially in places like Mumbai, which accounts for a majority of those cases, for more capacity in terms of hospitals. That's something that Sukirti pointed out. They already are creating capacity for 76,000 plus beds simply for COVID care patients. Now, this is something that they say will help them address the problem to a large extent. They're already looking forward at May, June, and the number of cases that they expect in those times, and accordingly they are creating the capacity for beds. Now, as far as Mumbai is concerned, it remains a worry because Mumbai has unique problems. It's one of the most crowded cities in the world. It got a slum population where people use community toilets, where water supply is very, very thin. So obviously even washing hands is a challenge in these places, and social distancing is practically impossible. So obviously for Mumbai, and the concerns in Mumbai are related to specific areas. Now, while there's Dharavi, there are other slums that have reported cases. It has also seen success stories. For example, Worli Kolivada, an extremely crowded area, now at least showing signs of being under control. So it is a multi-pronged approach that authorities say they're taking, right. And they clarify one thing, that they will not, sort of control testing, even though they put curbs on testing.